I'm here today to discuss our invited editorial, which is part of a monthly series that the editor Carl Nath has done to commemorate 100 years of continuous publication by the Mayo Clinic Proceedings. I'm Dr. Carl Chip Levy. I'm Medical Director of Cardiac Rehabilitation and Preventive Cardiology and Director of the Exercise Laboratories at the John Ochsner Heart and Vascular Institute, Ochsner Clinical School, the University of Queensland School of Medicine in New Orleans, Louisiana. And I also happen to be one of the associate editors and the cardiovascular section editors of the Mayo Clinic Proceedings. And the topic of this editorial is cardiorespiratory fitness and Mayo Clinic Proceedings. First, I'd like to acknowledge and congratulate the excellent efforts of my co-authors. First of all, Dr. Jari Lukanen, and I'd also like to congratulate and acknowledge the editor-in-chief of the Mayo Clinic Proceedings, Dr. Carl Nath. I'd also like to give a shout out to the other cardiovascular section editor and one of the associate editors, Dr. Scott Wright. I actually have been interested in fitness for a long time. During my mentors during my Mayo Clinic fellowship in cardiovascular diseases in 1986 to 1989 were Doctors Ray Squires and Jerry Gall, and Thomas Allison came toward the end of my fellowship and also joined in their mentorship. Probably my main mentor in cardiorespiratory fitness during the last 25 years has been my close friend, now late friend, Dr. Steve Blair, who is often considered the father of aerobic fitness from his work in the Aerobic Center longitudinal studies several decades ago from the Cooper Clinic. Dr. Blair loved the Mayo Clinic Proceedings. He had his first paper many of his papers were on obesity, but one in 2002 in the Mayo Clinic Proceedings were about that when you talk about obesity, you have to think about physical activity, exercise, and cardiorespiratory fitness. Certainly, the Mayo Clinic Proceedings has made a major advance in cardiorespiratory fitness, many studies over the last 2 decades. Certainly, many papers show that cardiorespiratory fitness is perhaps one of the strongest risk factors for cardiovascular disease. In fact, people who have a certain risk factor, like obesity, hyperlipidemia, smoking, but who are fit, usually have a better prognosis than those without the same risk factor who are not fit. In 2022, my co-author of this editorial, Dr. Jari Lukanen from Finland, had a major meta-analysis, probably the largest of its kind in the Mayo Clinic Proceedings, of 37 studies with 2.3 million participants that had over 100,000 deaths to analyze, and showed in this meta-analysis that for every one estimated MET increase in cardiorespiratory fitness, there was an 11% reduction in mortality. And those in the highest tertile of fitness in this meta-analysis had a 45% lower mortality than those in the lowest tertile. I was very pleased to be able to write the editorial for this major paper in 2022 with my colleagues Ross Arena and Lenny Kamitsky, and we emphasized in this editorial that we felt that fitness should be routinely measured in clinical practice, or at least frequently measured, and this should be a vital sign. Now, I've actually published the most in the world in the last 2 years on the topic of obesity, and particularly on the obesity paradox. And the Mayo Clinic Proceedings have played a very significant role in this as well. In fact, one of our papers by Salvatore Carboni on obesity and heart failure was I think the most cited paper for a couple of years in the proceedings, and continues to be one of the most cited papers of all time. In this paper, we talked about the obesity paradox, but also the importance that fitness played in this process. An obesity paradox means is that obesity is a significant risk factor for obesity increases almost all the cardiovascular risk factors and markedly increases cardiovascular disease. But once patients develop cardiovascular diseases, the overweight and obese are seeming to have a better prognosis in many individual studies and meta-analyses. And we discussed all this in the paper. But certainly the two of our major papers in the Mayo Proceedings 15 years ago showed the importance of fitness in the obesity paradox. One was by Paul McCauley of 10,000 coronary heart disease patients from Steve Blair's aerobic center longitudinal study, with the patients followed on average for 13 years. And we measured fitness on the treadmill and defined fit as not those not falling in the bottom tertile of fitness. And we assessed body composition by BMI, percent body fat, and waist circumference. And in this paper, we showed that those who were relatively fit had a very good survival and cardiovascular disease survival, regardless of their body composition. But the unfit, those falling in the bottom tertile of fitness, had a high mortality, a high cardiovascular mortality. And in this group, there was a strong obesity paradox, a little bit heavier, higher BMI, higher waist circumference, higher percent body fat, had a better survival than did the unfit who were thinner. In another paper, the next year in the Mayo Clinic Proceedings, Dr. Ross Arena allowed me to use his cardiopulmonary stress testing in a group of 2,066 systolic heart failure patients. And we defined in this paper those who were fit as having a peak VO2 measured by cardiopulmonary gas exchange over 14 cc's of oxygen per kilogram per minute. That's the cutoff that Donna Mancini defined many decades earlier, and it was often used to list patients for cardiac transplantation. We showed in this paper that the heart failure patients who had a relatively preserved fitness had a very good survival regardless of their BMI, whereas those who were unfit, falling below the 14 cc's of oxygen per kilogram per minute, had a high mortality, and there was a strong obesity paradox. In this group, the obese had the best survival, followed closely by the overweight, and the worst survival was in the normal BMI systolic heart failure patients with low fitness. We'd already excluded the underweight because they almost always have a bad survival. These papers in the proceedings really made the case that fitness markedly alters the relationship between adiposity or fat and subsequent survival. Now, we know numerous papers have demonstrated the importance of fitness on cardiovascular survival and in cancer survival, particularly things like breast cancer and colon cancer. But there was a couple of papers in the proceedings, one last year by Josh Sparks of 36,600 patients followed for 17 years, that showed that in a large group of men, that fitness was a very strong prognostic factor for mortality from non-cardiovascular disease and non-cancer. And the year previously, Dr. Tom Allison's group from the treadmill data bank assessed 13,400 treadmill tests in primary prevention with a 13-year follow-up and showed that the fitness measured on the treadmill in primary prevention predicted not only cardiovascular disease mortality, but non-cardiovascular disease mortality. And Jamal Ozamak, Ross Arena, and I were privileged to write the editorial for that paper. Fitness also played a part in survival in COVID. The Mayo Proceedings was one of the first papers on this back in 2021, soon after the COVID was rampaging the country and the world. Clinton Bronze and Steve Katayan from the Henry Ford Institute had a paper of 146 COVID patients who had their fitness measured previously and showed that the previously measured fitness was a very strong prognostic factor in the COVID patients. I was privileged to write the editorial with this along with Fabian Sanchez Gamar from Spain and Ross Arena. And we emphasized in this editorial that fit is it in COVID and beyond. And we discussed the fact that this may be particularly important for the African American populations who we previously demonstrated have low levels of fitness and even have low responses to exercise training to improve their fitness compared to Caucasians. And we all know that early in COVID, the African Americans were particularly a vulnerable group. Now, more recently, Jonathan Myers, Peter Kokonos, and I assessed data in 23,000 COVID patients assessed from the VA data bank, and demonstrated in this paper that in the patients who developed COVID at the beginning of the pandemic, that fitness was probably the strongest predictor of survival in this very large VA cohort. In fact, regardless of cardiovascular disease, chronic kidney disease, race, age, fitness was a very strong. In fact, it was probably the strongest predictor of survival, other than age, for predicting survival in COVID. And certainly, we've had many, many other papers on fitness. Papers combining fitness and coronary calcium scans, a lot of papers from the FRIEND data bank, a United States and international data bank on cardiorespiratory fitness that have really elevated the field of cardiorespiratory fitness. Fitness is somewhat genetically determined, but most of fitness comes from physical activity, exercise training. And so the Proceedings has also had some very major papers emphasizing this. For example, in 2022, Gervais Noman and Ulrich Wislov from Norway assessed 450,000 participants from China who were followed for 8 years, and showed that a personal activity intelligence, which assessed physical activity and gave more points to physical activity done with higher heart rates, which generally is needed to improve fitness more, and showed that this was a tremendous predictor of cardiovascular disease and all-cause mortality in this large Chinese population. Lenny Comiskey led the editorial for that paper. I co-authored a major physical activity paper of 600,000 recently, showing how physical activity impacted cause-specific mortality and cardiovascular mortality, and was particularly protective in those with cardiovascular disease, even more so than in primary prevention. Another paper in 2023, led by Celine Varani, with Doctors Martha Galati and I being co-authors, of 4.4 million respondents, we demonstrated a very strong gender disparity in physical activity. And this was more in certain groups of women, like the young and the older women, more so than the middle-aged women. But this is probably very important because a recent JACC paper showed that women actually benefit even more from improving their physical activity and fitness than do men. So we also in this editorial discuss some of the mechanisms by which fitness may be protective, not just for cardiovascular disease and cancer, but for other conditions. I'd like to, again, thank all of the co-authors that have worked with me on cardiorespiratory fitness, all of the fitness authors who have submitted and published their papers in the Proceedings the last 2 decades, and the editors, both Dr. Bill Lanier and particularly Dr. Carl Nath, my co-author on this editorial, for all of the support that they've given to the importance of cardiorespiratory fitness and physical activity, and making the Mayo Clinic Proceedings a leader in advancing the field of science in this area. Thank you very much, and I hope this video and editorial ends up being helpful to the readers of Mayo Clinic Proceedings. Thank you.
We hope that you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access to information for our social media content, such as additional videos on our YouTube channel, www.youtube.com Mayo Proceedings, or journal updates on Facebook, www.facebook.com Mayo Clinic Proceedings. You can also follow us on X, formerly known as Twitter, available at Mayo Proceedings. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This content is copyrighted by Mayo Foundation for Medical Education and Research, published by Elsevier Incorporated. All rights are reserved, including those for text and data mining, AI training, and similar technologies.